Case 1. 1-month-old baby, presented with repeated projectile vomiting. This is cine clip of transverse ultrasound examination through the epigastric region. What is your diagnosis? You can see in this image, the pyloric canal is enlarged, measuring about 15 mm in length, and 5 mm in muscle thickness. Real-time examination revealed no passage of gastric content through the pylorus, at any time during the examination. These ultrasound features suggestive of congenital hypertrophic pyloric stenosis. Case 2. 23 years old female on first trimester pregnancy follow-up. According to her last menstrual period, gestational age is about 12 weeks. This is cine clip of ultrasound examination of the uterus, by trans-abdominal approach. Another cine clip of the uterus by trans-abdominal approach. Last cine clip of the uterus by high-resolution probe through trans-abdominal approach. What is your diagnosis? The image on your left side shows an embryo measuring about 8 weeks gestational age by crown rump length, with no visible cardiac pulsations. The image on your right side shows the developing placenta, which is enlarged relative to the size of the uterine cavity, with innumerable tiny cystic spaces. These ultrasound features are suggestive of partial hydatidiform mole with missed abortion. Case 3. 10 years old boy presented with right iliac fossa pain and vomiting. This is a cine clip of ultrasound examination through the right iliac fossa. Another cine clip of ultrasound examination through the right iliac fossa. What is your diagnosis? There is a blind-ended, thick-walled, non-compressible tubular bowel structure in the right iliac fossa, measuring about 7 mm in diameter, and surrounded by echogenic omental fat. These features suggestive of acute appendicitis. Case 4. 40 years old female with abnormal uterine bleeding and negative pregnancy test. This is a cine clip of ultrasound examination of the uterus by trans-abdominal approach. Another cine clip of ultrasound examination of the uterus by trans-vaginal approach. Cine clip of the cervix. Right ovary. Left ovary. In the previous cine clips, the uterus appears bulky due to multiple hypoechoic interstitial fibroid lesions. On the middle image, there is multiple tiny cervical Nabothean follicles and minimal free fluid in the Douglas pouch. The image on your right side shows the right ovary contains 3.5 cm simple cyst, with thin wall and clear internal fluid content. Case 5. 10-year-old boy presented with skin rash and abdominal pain. This is a cine clip of ultrasound examination with high-resolution probe through the right side of the abdomen. These two images were obtained from the right side of the abdomen. What is your diagnosis? The image on the right side of the screen shows diffuse mural thickening and edema of small bowel loop segment, with small reactive mesenteric lymph nodes. This bowel loop shows decreased peristalsis. The image on the left side of the screen shows minimal free intraperitoneal fluid collection in between the bowel loops. These ultrasound features, together with skin rash, are suggestive of Henoch-Schönlein purpura. This diagnosis was confirmed clinically and laboratory. Case 6. 6-year-old boy, with past history of RTA and hospital admission, as well as urinary bladder catheterization since 2 months. The parents gives history that patient try removing Foley catheter by himself. Now presented with hematuria. This is cine clip of ultrasound examination of the urinary bladder. Another cine clip of urinary bladder ultrasound examination. There is intraluminal oblong-shaped echogenic structure, with hypoechoic center seen at the bladder base. The lesion casting posterior acoustic shadowing, and appears approaching upon the bladder outlet. Based on given history, retained calcified Foley catheter balloon was suspected. This diagnosis was confirmed by cystoscopy.